Hi, my name is Dr. Robert Antolak. Our office is at thegentledentist.com. We're in Shelby Township, Michigan, and our phone number is 586-247-3500. At our office, we do a full range of services in dentistry, from implants to regular general dentistry and also cosmetic dentistry. And I've had the opportunity to, this is Kathy, and we had the opportunity to do some veneers on her. And I thought this story would be very interesting for you to see, those who are searching out for what cosmetic dentistry is and the experience that Kathy's had here. So, Kathy, when you had sought us out, I know you sought us out on the internet first. Maybe you can share with us a little bit about what you were looking for when you came into a dentist and to do some things. And also, you shared an experience when we first talked about how you had, when you were a young girl, when you just graduated from high school, what you did with your mouth. So if you can just share with that a little bit.
Okay. All right. Obviously, I told you when I was younger, I was very self-conscious about my teeth. I had a lot of tetracycline staining because my mom had taken tetracycline when she was pregnant for me. So I grew up with that, and I really wanted to have my teeth done. So when I graduated from high school, I used my graduation money to have resin bondings done. Okay. And I had 12 of those done, 6 on the top and 6 on the bottom at the time. Those were supposed to last, 5-10 years. They lasted a lot longer than that. They did good. But when veneers started becoming popular and I heard about them, I obviously wanted to then get veneers done at some point. I did not have an opportunity to do that until just recently, a couple years ago. So when I did, I started looking around for a dentist who could do that. My dentist at the time did it, but I know they don't do cosmetic dentistry, so I didn't want to just go to somebody to do it. I wanted it done well. Right. So I started looking around, and I went several places and got estimates and talked to several people. The other places I went had they would give me estimates. They'd look at my mouth and give me estimates and say, give us a call back when you want to be, when you know what you want to do. But when I came here, what impressed me was the fact that you said to me, let's look at your entire mouth, let's make sure everything's healthy, let's make sure that the underlying stuff is sound before we put the cosmetic stuff on. Right. So that was one of the things that I really liked, was making sure that it wasn't just a cover-up, it was everything underneath was how it should be, so that the veneers could last and they would do what they were supposed to do and be on there good long time. Yeah, that's really important that we don't just put something on, because if people have issues with grinding their teeth and things like that, these veneers will just chip if things are not managed correctly and properly. So it does take that extra level of making sure that everything is done right. Right. Great. And so what has your experience been like after these were done? I had them done, and it was a little bit of an adjustment. I know you had told me it was going to be, and it's funny because you think, I'm going to throw them on and it's going to be woohoo, and it was, but it was an adjustment. Like when you look at yourself in the mirror, you have to kind of stop and go, whoa. So I spent a lot of time in front of the mirror for a couple weeks. And then I've recently gone back to school to pursue, my teaching certificate. So I'm in school with much younger people now, and honestly, it's been really nice because I'm not self-conscious. Yes. I'm not, in my age group, there's quite a few people with some of the tetracycline staining, and, they're getting older, their teeth are getting, so it's not quite as big an issue when you're talking to somebody. But when I'm going to school with all these kids in their early 20s, right. I'm like, it's nice because I can smile and I can do presentations, and I don't have to feel self-conscious that, I know that they can tell that my teeth are stained, and they're thinking, how old is she?
Right,
so that's been very, very nice. So it's given me a lot of self-confidence.
Helped you to feel a little bit younger.
Yes, yes. And I need to do student teaching in the fall, and I'm like, that's nice because I know I'm going to go in there and be very confident in being able to smile at the kids and talk to them and stuff. I'm not going to be in there, worried about how my smile looks or.
It's true. A lot of times what happens is that when people's teeth are stained or they don't feel confident about their smile, they kind of keep that to themselves, and then the people around them actually then think about, wow, what did I do wrong? Why aren't they responding how someone who should be responding? And so there's really ill effects from that too. So you can really allow that if your mouth feels good and you feel good about that and about yourself, then it allows your true self to come out, and then others around you. So that's exciting. So well, thank you very much for sharing, and we're gonna just continue with that. And if you have any other questions, you can call our office at, once again, it's 586-247-3500. We're in Shelby Township, Michigan. And our website is thegentledentist.com. Thank you very much. Have a great day.